Good morning, everyone. My name is Elle Jarvis. I'm the founder of In the Weeds, a national 501c3 public charity that is based in Boston, Massachusetts. And our mission is to champion the physical, financial, and mental health of the hospitality professional. I'm actually coming to you with mask from a ballroom in Chicago, doing the same thing here in Illinois. But we are very grateful to our partners at the Mass Health Connector to help us in disseminating the information of the resources that are available for affordable healthcare in Massachusetts to hospitality professionals. So we're going to go ahead and get started. This presentation is recorded, so we will be distributing after the presentation wraps. Just a few notes. Everyone's audio has been muted and the video has been disabled. We are recording this. So to maintain everybody's privacy, we went ahead and did that. The presentation portion will last approximately 30 minutes. Then we'll have time for your questions to be answered at the end. If you would like to ask a question at any time, please use the Q&A functionality or the chat option. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others are on the call and will be able to see what you have written, another added protection for your privacy. If you have a specific personal scenario that you want to discuss with someone, we will be providing contact information for the Health Connectors Customer Care Service Center and instructions to help to find a local navigator. Again, we are recording today's call. Following today's meeting, you'll receive an email with the presentation along with the brief survey about the information that we shared. So there's no need to take detailed notes. Please complete the survey if possible, as we appreciate your feedback on today's session and your input with helping us develop future presentations. And for those who have watched and participated in the presentation, please share with all of your friends in the restaurant industry that could benefit from the information that we're sharing today. So I'm going to introduce Nikki and let her introduce herself. She'll be leading the presentation, and I'm really looking forward to it. Thank you for being here.
Thank you so much, Elle, and thank you for this opportunity to allow us from the Health Connector to share information about coverage options. So I'm Nikki Conti, and I'm the Associate Director of Public Outreach and Education at the organization. And I'm also joined by my colleague, Melissa Montrand. And I think I saw another colleague or two from other organizations who are on. So we're happy to be able to give you this presentation. Again, I think many of you may be watching this as a recording. So know that this information is out there for you. We want you to have this information, and that there are many people who work in the Commonwealth who are able to help you with this process, available to help from start to finish for free. So let's get started. I'm going to spend some time talking about health insurance, and in particular, how to get coverage and savings through the Massachusetts Health Connector. So I won't assume anything. I will start today's presentation by giving an overview of the state's Health Connector, and then I'll give some information about the American Rescue Plan. Then I'm going to dive a bit deeper. I'll be talking about getting coverage through the Health Connector, ways in which you can get help. It's a lot of information, so I will be summarizing this and then pointing you to some other resources that could be helpful for you as you're going through this process. So let's begin by just orienting you to the state's Health Connector. So we are the state's health insurance marketplace. We're here to offer individuals, families, and small employers access to affordable health insurance coverage. So you might be wondering, okay, who gets coverage through the Massachusetts Health Connector? And it's essentially people who don't have access to health insurance either through their jobs or through some other sources. So those are the folks that can apply. A lot of people who do apply get help paying for their coverage. People can buy health insurance coverage through us. They can also purchase dental insurance coverage through us. Now, when you are looking at all of the available health insurance plans through the Health Connector, I think one of the most important items that we'd like you all to keep in mind is that all of the plans sold through the Health Connector meet state and federal standards for coverage. So you can rest assured, these are comprehensive plans. You will not be penalized on state taxes when you enroll in the plans available through the Health Connector. So I'm going to go through these blocks of information a little bit, and try to provide you with some more context without getting into too much health insurance lingo. So all of the plans on our site, as I said, meet state and federal standards. They're all considered qualified health and qualified dental plans. And there are a number of offerings from leading carriers across Massachusetts. So depending on where you live, you may see different options, but essentially that's just based on that carrier's availability in that area. Moving on to the middle section of the screen, where we've labeled health plans with advanced premium tax credits. There are going to be people who have incomes within a certain range who can qualify for tax credits. And that's how they get to reduce the cost of their monthly premiums. So I'll spend a bit of time on that, particularly since the American Rescue Plan was recently passed. It passed in March. So there are more tax credits available to help people lower the cost of plans. Then there is the Connector Care Plan. So people in lower income ranges who meet other eligibility requirements might qualify for low or no cost health insurance coverage. Also, we have catastrophic plans on the Health Connector's website, and those are available to people who are 30 years or age 30 or under, or if someone has a hardship exemption. And then lastly, we have dental plans. So dental plans, people can buy them from themselves, their children, families, small employers, and those include pediatric only plans and plans with lower and higher deductibles. So with that, I'm going to take us to the slide and just describe the American Rescue Plan a little bit. So as I had just mentioned, this new law was signed into federal law in March of this year. So it makes financial help a little bit easier for people to be able to get health insurance. Many people who are getting health insurance through the Health Connector already saw a lot of savings, but now they could save and see even more savings. And a lot of people who did not qualify for help will now see lower monthly premiums. So we're really happy about that. On this slide here, I just wanted to point out some of the sample premiums that are going to be available through the American Rescue Plan. So really important to note is, depending on someone's age and where they live, the cost of the savings are going to vary. So for example, if there is a 50-year-old living in Worcester who's making approximately just over $44,000, they could be eligible for a plan through the Health Connector and be receiving advanced premium tax credits. And before the American Rescue Plan, that person's coverage would have cost them $371.58 a month. Now with the American Rescue Plan in place, they could be seeing monthly savings of over $100, so $101.76. So that's a really great monthly savings. Conversely, if there is a 30-year-old living in Boston who's making about $30,000 a year, if they apply and they're found eligible for the Connector Care program, this person would be eligible for a plan type 3A, and their monthly premium would have been $89. But with the American Rescue Plan, they'll be seeing some additional monthly savings, just over $13 a month, but still a savings. And so that premium gets knocked down to $75.91. Now, I won't go through the chart in Great Barrington. You can see that example, but I do want to point out that Those folks who may be listening to this who are from the islands area, Massachusetts and Nantucket, Martha's Vineyard, those folks may be seeing really, really good savings right now. And that's primarily because there are limited carriers in that area and the cost of coverage is higher in that area. So here you can see that this 45-year-old living in Nantucket making just, around $51,000 a year, who wasn't formerly eligible for subsidy, and they were paying about $650 a month for coverage. And now their new monthly premium is $366.05, saving them over $284. So that is really great news for folks living on the islands. So now let me just jump to who can apply for coverage. So as I started to my time, who gets coverage through the Health Connector, there are some important things to know. You need to live in Massachusetts. You need to be a U.S. citizen, U.S. national, or otherwise lawfully present. And you need to be someone that doesn't have access to health insurance. You should not apply if you're already enrolled in Medicare or the state's Medicaid program known as Mass Health, or you have other public health coverage. Also, if you're offered other affordable comprehensive health insurance from an employer, so it might not be your employer that's offering you this coverage, but if you have coverage available to you from a spouse or partner, you wouldn't be eligible to get coverage through the Health Connector. In addition, if somebody is in jail, they would not be eligible to get coverage through us. So let's talk about when you can enroll. So open enrollment is essentially the time when you can apply for new coverage for the coming year, renew your coverage, or shop for a new plan without needing to have a reason. So for whatever reason, if someone does not have coverage during open enrollment, you can apply, and if you are determined eligible, you can enroll. So this is great news. Typically, open enrollment runs from November 1st through January 23rd. This year, however, due to COVID-19, due to the pandemic, and just us wanting to keep the doors open so people can get in for coverage, open enrollment has been extended through July 23rd. So very important. If someone applies and is found eligible for coverage, your health and dental coverage can start as early as the first day of the month after you enroll. I always try to remind people that if you need coverage sooner, or you're just not sure what to do, just apply as soon as possible. Depending on what's going on right now, particularly in the restaurant industry, you might not be making as much money as you've previously made. You might be collecting unemployment income. You might be coming to the end. Everyone's situation is different, but you may find out that you qualify for the state's Medicaid program, Mass Health. And if that is in fact the case, you may get your coverage started earlier than the first of next month. So let's continue on with applying for coverage. There are 3 ways to apply. You can apply online at mahealthconnector.org. We also have a fully functioning Spanish website. So it's mahealthconnector.org, and I believe it's /ES. So you can go to these websites on your own and begin the process. You can also apply over the telephone, and that's for free, and you'd be working with Health Connector customer service to complete that application. Or lastly, you could apply with help from a partner community organization or a community health center. Now, really important, there is one application in Massachusetts to find out if you qualify for coverage through the connector or through Mass Health. So I I mentioned that because after you've applied, you're going to receive letters from both the Mass Health Organization as well as the Health Connector organization. We are two separate state agencies. However, because we share an application, we're legally required to send you these letters. So I just want to, kind of alleviate any confusion now, because when someone qualifies for Health Connector coverage, they are required to get a letter from Mass Health that says they don't qualify for Mass Health. And conversely, if someone qualifies from Mass Health, they have to get a letter from the state's Health Connector telling them that they don't qualify for our programs. Now, you may be wondering what you need to apply. So social security numbers for everyone who's applying, if you have one, immigration documents for any non-US citizen who's applying. And if you aren't quite sure, you're looking at your documents, you're not sure quite what things are, you can take a look at this link from our website, and you can review the different immigration documents, and simply, it will help you. These help you match up your documents. Now, in terms of pay information, if you have it, it's helpful to have copies of your last 2 pay stubs. If you're collecting unemployment or you collected unemployment at any time in 2021, we need that information as well. It's called a monetary determination. So some people may have that letter handy still from the state's Division of Unemployment Assistance, or you can log in to the DUA website and you can get that information. And if you've gone back to work, just generally, we need information about current income. Now, important to note here, if you don't have all the information that I've listed above, just provide as much as you have. The state will send you a letter asking for any more information if they need it. Now, on slide 15, I just want to orient you to the application. So if you go to mahealthconnector.org, there's an area where you can click on the individual and families application, and I may be able to guide you there. Also, their link to the Spanish site is there. And as a reminder, you're completing, if you decide to apply, you are completing one application for the Health Connector, and we'll also look to see if you're eligible for Mass Health. So really important on this slide, if you have ever applied for health insurance through the state before, you don't need to create another account. You can go back into the account that you had previously created. So you can just click on sign in, and you can do that. Or if you've never applied before, you do need to go through creating an account. If you get stuck, because let's say you had applied before and you're not quite sure, and you need some technical help getting back into your account, you can call the state's, you can call the Health Connector, and customer service can help you with that process. Now, you might be wondering, okay, you are going to be asked questions about entering income, and particularly if you're unemployed, you might be wondering how you should, what you should be saying, because we're going to ask you about current income as well as estimated income for the year. So your current income basically is the income as it is right now, and you want to include unemployment income. Now, for expected yearly income, we need you to try to anticipate what you think you're going to make for all of 2021. So I know you don't have a crystal ball, but essentially you want to consider how much money you've earned up until this point of the year. You want to include any unemployment. If you're getting any extra dollars, I believe right now the additional, the supplement for unemployment is $300 per week. You want to add that in. And if you think you're going to be going back to work later in the year, you also want to include what you might earn. Very important here. You can go into the application and you can update your income. You want to keep this as correct as possible. So I just want to point out that, enter your best estimate, your best accurate estimate, but know that you can go back into the application. And we encourage you to go back into the application whenever your situation changes to keep your application up to date. Now, we want you to keep your application up to date because it's going to help you get the right amount of help paying for your health and dental coverage. And it's also going to help you lower the risk of owing the IRS any dollars when you file taxes next year. So really important, I mentioned that the American Rescue Plan provides more savings, more dollars, and that they're doing that through these advanced premium tax credits. However, you're committing to having this information be as accurate as possible. So if you are looking at those dollars and you're thinking, okay, maybe I don't want to take the full amount of tax credit that they want to offer me, there is a slider tool from within the application, and you can take less advanced premium tax credits, and that is going to help you reduce the risk of owing the IRS more dollars when you file your taxes. So I know that's a different concept to keep in mind, but I want to be sure I said that. So let's talk about getting help paying for coverage. So in the beginning of the presentation, I mentioned that there were two kinds of help, two kinds of help or two kinds of programs that are available through the Health Connector. So the first is advanced premium tax credits. So those lower the premium amount you pay each month. The IRS sends those dollars directly to your insurance company. You just pay the lower monthly premium if you owe a monthly premium. And as I said in a couple of slides back, you get to choose if you want to apply your entire advanced premium tax credit, or if you want to lower that tax credit that you want to apply towards your health insurance premium each month. We also have the Connector Care program. So the way the Connector Care program is structured is it uses advanced premium tax credits, so federal dollars, plus state dollars, and those together help reduce the monthly premium amount that you're responsible for paying. Now, the Connector Care program is unique to Massachusetts, and it offers low monthly premiums, low out-of-pocket costs, and no deductibles. So we're talking about really comprehensive coverage with great savings for the consumer. Now, depending on the plan type that you qualify for, you could choose a plan for as low as $0 up to $133 per month. And we do have a chart at the end of the presentation that you can look at, as well as going to our website for pricing. Now, the income guidelines for getting help for coverage. So I just want to point out that for the Connector Care program, we are following particular income guidelines. So if an individual's income is up to 300% of the federal poverty level, if it's at or below, they otherwise qualify for Connector Care coverage. So as an example, if you are a family of two making $51,720 or less, you could qualify, you may qualify for the Connector Care program. Now, before the American Rescue Plan, the income limit for advanced premium tax credits was 400% of the federal poverty level. So the American Rescue Plan removes that income limit to get advanced premium tax credits. So people with incomes greater than 400% of the federal poverty level may now qualify for advanced premium tax credits. So the way that we're doing that is instead of an income limit, people are going to qualify for advanced premium tax credits based on affordability. So we are going to ask a series of questions in the application, and the system makes a determination. And so people will, advanced premium tax credits are going to be available to help lower the monthly cost of health plans so that um, those health plans are not more than 8.5% of somebody's annual income. So again, more savings for the consumer. Now, we know this is quite a lot of information already, but as you're going through this process, after you get through the application process, you're going to need to choose a plan and enroll. So you might be thinking, okay, well, how do I choose the right plan? How do I start this process, particularly if you've never done this before? We do have lots of tools on the Health Connectors website that can help you with this process. You can compare your plans based on providers, the provider network, medications that are covered through each of the plans, and you can use the comparison tool from our website, and you can follow this link when you get the presentation, and you can see what that looks like. You can also, if you're not sure what these plans are going to cost, you can find pricing before you complete an application. So I want to caution you, if you are, depending on when you are comparing prices, if you go to this preview plans tool from the application homepage and you look at the pricing, you're going to see the true cost of the health insurance plans without any subsidies. So we don't want to scare you away. We are actually working on a brand new tool that should be available towards the end of May, where where you can enter some brief information about yourself and you can see a cost estimate of that monthly premium that you would pay. So as you see in the note here, those who qualify for Connector Care won't see cost savings, but know towards the end of May, we're going to have a brand new tool that you could use. All right. Now, when you're in the online application, you also have the ability to filter your plan choices by your preferred providers and prescription drugs. So here you just simply need to say, yes, I want help finding a plan, and tell us what you want, which search tools you want to use. And in this screen, on this screenshot, I put in a couple of doctors and I put in a facility. I put in the North End Waterfront Health Center. And you're seeing here that the choices that are available on the right-hand side basically are the choices that have been filtered through the search criteria that I put in. And again, the costs that you're seeing right here for the Tufts Health Plan Standard High Bronze, you're seeing that without any monthly savings, you're seeing the full cost of that health insurance plan. Now, if someone is required to make a payment, it must be received by the 23rd of the month before your enrollment is considered complete. And you can submit an online payment by clicking the Make a Payment button from your screen. So if you are going through this and you're thinking, okay, this is lots of information, we just, again, want to point out that you can get help from customer service as well as community partners. And remember that all of this help is free and it's available across Massachusetts. So over the telephone, you can call the Health Connectors Customer Service Center at 877-623-6765. Also, if you need information about hours, hours of operation, etc., you can call, look on the website and find that information. If you're looking for a community partner, so for example, I mentioned one of the colleagues on the line is one of our navigators, And people who work in these navigator organizations speak many languages that are reflective of the community that they're serving. So if you need help in a language other than English, we probably have someone out there that can help you. So come to our website. There is a link on this page that can help you find free help near you. Particularly right now, we recommend that you call ahead and schedule an appointment for help. And know that when you are connecting with a navigator, they can help answer questions from the start of the application all the way through enrollment. So you can ask some questions about your eligibility, details about your plan, etc. They're here to help you. So let's summarize some of these key points. So depending on who's listening to this presentation, just want to acknowledge that if somebody is losing employer coverage, that is considered a qualifying life event, and that gives you a special enrollment period for enrolling through the Health Connector to get coverage. Really important. You need to apply and compare your options through the Health Connector within 60 days of losing your employer coverage. You can apply for coverage online or by phone with the help of an assister, and some people will get an automatic special enrollment period to shop and get into coverage right away. If for some reason you apply and can't shop for coverage, contact Health Connector customer service to get some help. Also important to acknowledge that we are still in an open enrollment period. So no questions asked. If you don't have coverage for whatever reason, and you qualify, you can get in. So again, if you're like thinking ahead this month, thinking, okay, what are my deadlines? You need to apply, enroll, and pay your first premium by the 23rd of the month before coverage can start for the first of the following month. So for example, if you're looking at coverage right now, you need to enroll, pick your plan, apply, enroll, pick your plan, and pay by May 23rd before your coverage can start on June 1. You can also choose to have your coverage start on the second month after if you'd like that for any reason. So just wanted to point out that technicality. And again, I can't stress enough that there is free help available right now. And you can call customer service to get this assistance. You can get help from a community partner organization. Right now, really, it's important to call today, make an appointment to get help. And, customer service can help you over the phone. But a lot of our navigator organizations, some of them are seeing people in person, but a lot of them are doing simply phone applications or virtual consultation, whatever your preference is. So certainly call to make an appointment. With that, I think, well, before I take some questions, I was going to see, Elle, I might be able to go to our website for one moment if that works for you.
Yeah, I think that would be extremely helpful.
Okay. And Elle, are you able to, okay, actually now I know what I'm doing. Let me know if this works for you. Are you able to see my screen?
Yes, we can see it.
I just, one second, I think my internet's doing something funny. Okay, great. So I just wanted to point out that from mahealthconnector.org, this is what our homepage looks like. And as you can see right front and center, we're reminding everybody that open enrollment is extended through July 23rd. And here, if you are ready to sign in, I would just click on sign in the upper right-hand corner. And as you saw from the screenshots that I'd shared, this is where you start the process. So if you've already completed an application, you do not need to start totally from scratch. In fact, we recommend that you go back to any application that you have and simply update it. You can sign in. If you have any difficulty signing in, the system will help you like retrieve a password if you've forgotten that, or you can call our customer service to get some help. I mentioned the preview plans tool that's available here, but also wanted to acknowledge that in the coming weeks, we will be introducing a brand new tool where you can see American Rescue Plan savings. So do keep that in the back of your mind. And with that, Al, I think I'd like to go back to some questions, or maybe, let's see, maybe there's a question that you'd like to make sure we answer that you think people may have.
Yeah, absolutely. So the questions that I had, you pretty much already covered. Some questions that I got before the presentation, things, how do I ensure that my current PCP or primary care provider accepts this new plan, which you went over. Another question was, if I don't have a primary care physician, how do I choose one that I know will be a good fit for me? Was a question that came in. And the last one that came was, I'm currently on Cobra. I'm in the MGH network attached to my behavioral health. How do I ensure that to choose a plan that would I be able to keep my own team? Which I think was another question that you already answered through the presentation.
Okay, great. No, that's really fantastic. So, maybe what I can do is just kind of latch on to something that just answer something or go a little bit deeper on something that you just mentioned when you had mentioned Cobra. So I think it's really, really important right now to acknowledge that that with Cobra, people are seeing with Cobra, people, and excuse me, the American Rescue Plan, people are actually able to stay on Cobra longer and get subsidies through the American Rescue Plan. Those subsidies are going to be ending in September. So if anybody is on Cobra and then they're thinking about their options, like should I stay on Cobra, getting these subsidies? A lot of people are going to be qualifying for this, really reduced costs Cobra. That would be something they should talk to their former employer about or current employer about if they're on Cobra. But I want to acknowledge that when Cobra, those subsidies for Cobra end, that will in September, the Health Connector does have a new special enrollment period beginning in September. Excuse me, not beginning of September. A new special enrollment period that's going to be available for beginning in October for those people. So I just want to be sure that people listening to this do realize that if the Cobra option makes most sense for them right now, fantastic, keep that. But know when those subsidies end, the Health Connector is here for you if you need that.
Fantastic. Thank you, Nikki. Any other questions from the participants, or if there's anybody else from the Health Connector that has anything else to add?
Well,
Go ahead.
Elle,
Oh, go ahead.
yes.
Yeah, go ahead.
No, I was just going to say, well, I'm actually happy to keep the recording shorter for folks. So hopefully more people will sit and listen through it. But know that we're here to help. And we really want, particularly now that we have this extended open enrollment, we really just want people to, reach out to our navigators, get help, and get coverage. It's really important.
It is. It's really important, especially for restaurant and hospitality professionals who are working with the public and the industry definitely has a wear and tear on physical and mental health. And, looking through the options of the different plans, it's really a holistic approach to the overall well-being, which we as hospitality professionals can't take care of our guests, which is attached to our livelihood if we're not taking care of ourselves. So I do recommend anyone who is watching the recording share with your friends in hospitality far and wide, because the more people that are covered, the healthier the industry is going to be at large for us for a more sustainable future. So if there are any questions or people have any troubles, please reach out to us at holler@intheweeds.us, and we'll certainly do our best to put you in touch with the right folks to get you covered. And again, Nikki, thank you so much. I think the lack of questions are like 100% as a result to how comprehensive the presentation is. So I really appreciate your time today.
Thank you so much. And thanks everyone. And be sure to reach out.
Okay, and get covered.
Thank you.
Thank you.